Scope, Human Longevity and Performance Podcast. Carotid Artery Ultrasound and Longevity. The opposite of longevity is death. If longevity is what we seek, we must obsess about death and those things that increase the risk of us dying. So, what's the number one killer? Cardiovascular disease. Cardiovascular disease is the biggest killer on the block, claiming the lives of 1 in every 3 people worldwide. Almost 1 million people a year die from cardiovascular disease, things like heart attacks and strokes, in the United States alone. The main cause of cardiovascular disease is atherosclerosis. But what is atherosclerosis? This is thickening and hardening of the artery walls caused by the deposition of plaque into the blood vessel walls. And plaque is made of things like cholesterols, fats, and other materials. Plaques can slowly grow, causing occlusion of a blood vessel. We call this stenosis. Plaques can also rupture or break open, leading to blood clots. You can think about ischemic heart attacks, strokes, and other infarctions. As a side note, an infarction is an obstruction of blood supply to an organ or region of tissue, usually from a blood clot or embolus. And plaques can also break away from the walls, forming emboli, or little pieces that break off and travel to other parts of the vasculature, eventually blocking the flow of blood flow. And these also cause things like heart attacks, strokes, and other organ infarctions like bowel ischemia, kidney ischemia, and other problems like that. Bad stuff. Thickening of blood vessel walls, plaques, and restriction of blood flow can all be visualized using, ding, 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 carotid artery ultrasound. In the body, if blood vessel disease, e.g. atherosclerosis, is seen in one area, it's likely present in other areas and other blood vessels as well. As such, carotid artery ultrasound is a very important longevity metric. This non-invasive imaging modality gives us important information about a person's risk for strokes, heart attacks, and even death. Several studies, actually numerous studies, have demonstrated an increased risk of death, also called the mortality risk, if atherosclerosis, plaques, or impaired blood flow are present on carotid ultrasound exam. All right, let's get into a little bit of background. And if you can pull up pictures, it will really help. But let's start with the carotid arteries. The carotid arteries are large blood vessels, arteries on both sides of the neck that supply blood to the brain via the internal carotid artery and the face via the external carotid artery. About 15% of the blood pumped from the heart goes through these carotid arteries. Essentially, each side of your neck has a carotid artery that forms a Y. The common carotid artery can be seen at the base of the neck, and as you move up the neck toward the head, the carotid gets wider, forming a bulb, and then this bulb splits into the internal and external carotid artery branches. Blood vessel, heart, and brain health are tightly linked to carotid blood vessel health. And due to the proximity, or how close the carotid blood vessels are to the surface of the neck, they can be visualized with a high degree of resolution with ultrasound. If longevity is your goal, carotid ultrasound is something you're not gonna wanna miss. Okay, a little background on ultrasound. It's an imaging study that uses sound waves to recreate images inside the body. This is possible because sound waves reflect at different intensities when they hit tissues made of different materials. So, the ultrasound probe sends out a sound wave. Those sound waves get partially reflected, and the probe picks up these sound reflections. An image is then created based on these reflections that bounce back off the tissue. Ultrasound is based on the same principle as echolocation, used by animals like whales and bats, as well as sonar, used for mapping the surface of the ocean, looking for fish in the sea or planes in the sky. That is, bouncing sound off objects and measuring what comes back. Additionally, and this is very cool, due to something called the Doppler effect, the velocity of flow of blood can also be measured using carotid duplex ultrasound. It's pretty incredible. Ultrasound allows us to view tissues in real time and not only see the tissues, but visualize them moving. And therefore, ultrasound is one of the most dynamic imaging modalities available. And another cool thing, it does not require the use of any ionizing radiation. Pew! Okay, what can be seen / can be measured on carotid duplex ultrasound? And I'll use carotid ultrasound, carotid artery ultrasound, and carotid duplex ultrasound. All of those are interchangeable. So the first awesome thing is just crisp, clean images of the carotid arteries. The carotid blood vessels can be seen very clearly from the base of the neck, just above the clavicle, all the way up to the skull. And as these blood vessels are so close to the surface, beautifully clear images can be obtained. The common carotid artery, the carotid bulb, internal and external carotid artery branches can all be clearly visualized. Okay, one thing we measure is called the intima media thickness. So blood vessel walls have 3 layers. The thickness of the middle layer, called the tunica media, and the inner layer, called the tunica intima, can be measured with ultrasound. This is typically done 1 centimeter before the bulb on the posterior or deepest wall of the artery. A normal intima media thickness depends a bit on age, because it does get thicker as people age, but less than 1 millimeter is generally considered normal. In my practice, I use a cutoff of less than 0.8 millimeters. However, for younger individuals, less than 0.6 millimeters may be more ideal. Okay, the next thing we measure is the resistance index. And this is something really interesting. But I talked about Doppler and how we can measure the speed of flow of blood. So the velocity of blood flow can be measured using ultrasound. This can be done in all 3 carotid vessels, the common, the internal, and the external, but is most often performed in the common carotid artery as it's the easiest to do. Blood flow velocity increases when the heart beats and decreases when the heart relaxes. The difference in blood flow between peak systole, when the heart's beating, and end diastole, which is when the heart's relaxing, can be used to calculate a resistance index based on this equation. So resistance index equals peak systolic velocity minus end diastolic velocity both divided by the peak systolic velocity. Resistance index shows how much resistance there is to blood flow, both distally, so to the brain, and proximally, from the aorta. Increased resistance can be a sign of blood vessel disease and is associated with an increased risk of things like hypertension and stroke risk. A normal resistance index is typically between 0.55 and 0.8, but some studies report an upper limit of normal of 0.7. Numbers greater than 0.7 show elevated resistance, and you can think that's correlated with things like hypertension, increased risk of stroke, and harder to pump blood to the brain. And numbers of less than 0.55 demonstrate a reduced resistance index, typically from things like arteriovenous malformations or increased total blood volume. And so we're literally getting values for how fast blood is flowing, usually in metrics like centimeters per second. Okay, soft and calcified plaques. So we can see soft and calcified plaques on carotid ultrasound. When enough deposits build up in the artery walls, these deposits are fat, cholesterol, and other materials, they can start to protrude into the blood vessel tube or lumen. And this can be visualized and measured on ultrasound as a plaque. Plaques can be soft or hard. Hard plaques have been stabilized with calcium. Hard plaques can often be visualized well with X-ray technologies, but soft plaques, much less so. Ultrasound can see both hard and soft plaques very well. And the number of plaques, particularly soft plaques, I am seeing in 20 and 30-year-olds at Longevity is alarming. I'm seeing these to some degree of plaque formation in almost everyone. Prevalence for plaques has been estimated at 21% of people aged 30 to 79 in large meta-analyses. So about 1 in 5 people aged 30 to 79 historically have had plaques in their carotid arteries. However, I suspect that plaque prevalence is skyrocketing and now much higher than this, largely driven by the epidemic of poor metabolic health, which is a driver of cardiovascular disease. Because of the blood flow dynamics present around the carotid artery bulb, so that place where the common carotid artery widens and then splits into the internal and external carotid arteries, plaques in this area, in the bulb, are perhaps the most common. And thinking about a river helps me understand this. The parts of the river with the most turbulent water flow experience the most erosion. So blood hits this widening and then has to split into two different vessels, and there's going to be more stress on the blood vessel wall in that area, therefore leading to more plaques and blood vessel disease. Okay, the next thing that can be visualized on carotid artery ultrasound is stenosis. And stenosis is a blockage of the artery. As the blood vessel wall thickens and plaques grow, they can start to literally take over the entire lumen or opening of the blood vessel and cause restriction of blood flow or stenosis. This can be seen visually on ultrasound. And as stenosis gets worse, the velocity of blood flow around it goes up. Let's think about a river again. Just think about how a narrowing in a river can increase the velocity of water flow to basically causing a local rapid or white water. So blood flow velocity around a stenotic plaque lesion can be measured. If no flow is present, the blood vessel is completely blocked. But as blood flow velocity increases, it demonstrates worsening of stenosis until, of course, complete occlusion occurs and velocity goes to zero. So those are some of the things we can see on carotid ultrasound. We can literally see just crisp, clean images of the carotid arteries, including the common carotid artery, the bulb, internal and external carotid artery branches. We can see the blood vessel wall and measure the intima media thickness, which is an early sign of blood vessel damage as that intima media thickness gets thicker. We can measure the flow of blood and calculate things like resistance index. We can look for soft and calcified plaques. We can also quantify plaque burden, so we can look at how many plaques there are. And then finally, we can look at stenosis or blockage. And along with this, I didn't talk about this, but we can also look at dilation. Dilation of the carotid arteries or widening of them is also a bad sign. So that's what we can see and measure on carotid artery ultrasound. And if you want to see how we actually do this, how an ultrasound of the carotid artery actually happens and what it looks like, you can check out our YouTube channel, Longevity Metrics, at Bill Brandenburg, MD. Okay, let's get into the common sense perspective, the clinical perspective, and the research perspective for why carotid artery ultrasound is a very important longevity metric. Okay, common sense perspective. The idea that a carotid artery ultrasound would be an important marker of longevity makes a ton of sense. Cardiovascular disease is the number one cause of death worldwide. We've all experienced this with our deceased loved ones. We all have people in our lives that have died from cardiovascular disease. It's the most common reason for death that we see. And the ultrasound study allows us to directly visualize one of the major blood vessels and to see if vascular disease is actually present. If blood vessel disease is seen in the carotid, it's likely present in other major blood vessels and even small blood vessels as well. Like it's kind of similar to if you see cockroaches in the kitchen. It's probably safe to say that cockroaches are also present in your walls, in the garage, and other areas of the house. So I think from a common sense perspective, we know that cardiovascular disease is a killer. We see it in our loved ones and the people around us all the time. And we know that we can see evidence of blood vessel disease on carotid artery ultrasound. So it seems from a common sense perspective that this would be an important longevity metric. What about the clinical perspective? Okay, heart attacks and strokes are very common, serious adverse clinical events and causes of death. I see this in the hospital and in the clinic all the time. We know things like hypertension, elevated atherogenic levels of cholesterol like ApoB and LDL-C, and metabolic disease are major risk factors for serious adverse cardiovascular events. The reason these problems lead to heart attacks and strokes is due to blood vessel damage. And this blood vessel damage, again, can be directly visualized using carotid ultrasound. So, carotid ultrasound allows us to directly see how much damage has been done to the blood vessel. Therefore, from a clinical perspective, carotid artery ultrasound seems very important. In fact, the evaluation of the carotid arteries with imaging is part of the stroke workup that's part of the standard of care. So if somebody has a stroke, it is part of the standard of care to image their carotid arteries and look for stenosis and plaque burden. We know that putting hairs down the drain increases the risk of a drain pipe getting blocked. So this is like a plumbing analogy. But the only way to see how much damage or blockage is present is to take a camera and visualize the inside of the pipes directly. Ultrasound gives us that direct visualization. Pew! All right, finally, and perhaps most importantly, the research perspective. And honestly, the research perspective was really hard to work through because there are so many studies. There's more than 1,000 clinical research trials looking at well over 1 million patients combined that have investigated carotid ultrasound findings and mortality. These include a variety of study designs, including cohort studies, many prospective, observational trials, and meta-analyses in multiple different countries and different populations. The findings of these studies are clear, consistent, and graded. The below findings on carotid ultrasound have demonstrated an increased cardiovascular mortality and all-cause mortality. So people with these things are more likely to die from heart attacks and strokes, and they're more likely to die from any cause as well, the all-cause mortality. So if we see increased intima media thickness, if we see the presence of plaques, and if we see narrowing or dilation of the carotid arteries, these are all well correlated with increased risk of cardiovascular and all-cause mortality. Wow. And as thickness, plaque burden, and stenosis get worse, so does mortality or the risk of dying. Let's look at each of these things individually. Okay, increased intima media thickness. Well, this is perhaps the earliest sign of atherosclerosis and plaque formation that you can see on imaging. As such, the link with all-cause mortality is not as strong as with the other above findings, but the increased risk is present even after adjusting for other findings linked to cardiovascular disease. For example, increased blood pressure. The Lorenzi et al. 2007 study published in Circulation is one of many studies demonstrating an increased risk of heart attack, strokes, and cardiovascular mortality or death, and all-cause mortality. And this study showed that for each 0.1 millimeter increase in intima media thickness, the relative risk of heart attack and stroke increased by 1.26 and 1.32 respectively. So it predicted stroke the best. And we're talking a 26 to 32% increased risk of those really bad things happening. Okay, what about the presence of plaque? The presence of plaque is a later stage finding of atherosclerosis than intima media thickness. Studies indicate it is a better and more accurate predictor of heart attack, stroke, and all-cause mortality than intima media thickness. And in various studies, hazard ratios for all-cause mortality were between 1.6 and 2.8, so 60 to 180% increased risk of death. And the higher the plaque burden, the greater the risk of badness. So increased intima media thickness is bad, but the presence of plaque is even worse. All right, what about narrowing and dilation of the carotid arteries? Same story, strong predictor of stroke. In fact, stroke is probably the most important thing, and that's why in clinical practice, when somebody has a stroke, one of the parts of the standard stroke workup is to image and evaluate the carotid arteries. So narrowing and dilation were a predictor of heart attack and all-cause mortality as well. And you can see some studies in the references. All right, what about increased resistance index? So this is measuring the blood flow and looking at the difference between peak systolic flow and end diastolic flow and divided by peak systolic flow. Well, there's no robust data demonstrating increased all-cause mortality with increasing resistance index. But the link between increased resistance index and other cardiac risk factors like end organ damage from vascular disease and increased risk of cardiovascular death is well established. And you can check out the Quillies et al. Study cited below. Pew! So, from a research perspective, we have thousands of studies, over 1 million patients in different countries and different populations, all showing that the risk of heart attack, stroke, cardiovascular mortality or death, and all-cause mortality or death all increase when these bad things are seen on carotid artery ultrasound. Pew! Okay, so what are the conclusions? Let's put it all together because this was kind of a doozy. And honestly, I wanted to crunch the data from the research studies more, but there was so much to say that I didn't. So please look at some of these references below and read the studies on your own. They're compelling because there are so many. Most all of them are in agreement, and it's a graded effect. So the thicker the intima media layers of the blood vessel wall are, the more plaques, the more stenosis, the higher the risk of death. Okay, so in conclusion, cardiovascular disease is the leading cause of death worldwide. Findings on carotid artery ultrasound, including increased intima media thickness, plaque burden, stenosis, and dilation, are strongly associated with increased risk of stroke, heart attacks, and death. Carotid artery ultrasound is relatively easy to perform, non-invasive, and provides important information about a person's future longevity above and beyond standard cardiovascular risk factors like hypertension and elevated levels of atherogenic cholesterol like ApoB. Carotid artery ultrasound is a very important longevity metric. It is a very important longevity metric. And the amount of young people I am seeing with plaques in the carotid artery are much, much higher than previously reported prevalence of 21%. In my practice, it's more like 90%. If longevity is important to you, strongly consider a carotid artery ultrasound, in my opinion, as early in adult life as possible. So that's carotid artery ultrasound, a very important longevity metric. I hope you enjoyed the episode. Again, if you want to see how we actually do this screening at Longetrix, check out our YouTube channel, Longevity Metrics at Bill Brandenburg, MD. We should have that video up sometime next week. Thank you so much for listening, and have a great day. Bye-bye. Thank you so much for listening to the Full Scope Podcast and Investing in Your Health. I'm Dr. Bill Brandenburg. If you're enjoying the content, please rate, review, and share this content with all of your friends online and on all your social media platforms. Please understand that this podcast is not intended to treat, diagnose, or cure your specific medical condition. This podcast does not create any type of doctor-patient relationship between myself, Dr. Brandenburg, and you, the listener. Be well, and thanks again for listening.